You or your child is taking the medication named enoxaparin.
Enoxaparin comes as a clear liquid for injection.
This is an anticoagulant of the family called low molecular weight heparin.
It is usually given by a needle just underneath the skin into the fatty layer. This is called the subcutaneous layer.
Your child will be on the medicine depending on your thrombosis team or your medical department.
Enoxaparin is usually given every 12 hours, 1 dose in the morning and 1 dose in the evening. Remember that 2 doses should not be given closer than 10 hours apart or more than 14 hours apart. If you decide to change the schedule, you may do so by pushing the dose 1 hour later at a time. Here is an example. If you want to change from a 6 a.m. and 6 p.m. schedule to a 9 a.m. and 9 p.m. schedule, give the first dose at 6 in the morning, and then the evening dose 1 hour later at 7 at night. On the following day, give the morning dose at 8 and the evening dose at 9. On the following day, you can start with 9 a.m. and 9 p.m. Once the dose times are fixed, try to keep them the same every day and not to miss any doses. It might be a good idea to set an alarm on your mobile device as a reminder. If you do forget to give the dose on time, give the missed dose as soon as you remember. However, if it is close to the next dose time, skip the missed dose and give the next dose at the regular time. Do not give 2 doses at the same time to make up for the missed dose. If you have any questions, please contact your medical or thrombosis team. Enoxaparin is usually given with an insulin syringe. It is important to note that 1 unit on the insulin syringe is equal to 1 milligram of enoxaparin.
Your child needs to have blood work done on a frequent basis to ensure that the right amount is being given to him or her. Blood work will be done at least every 3 to 4 weeks depending on your levels. It will have to be done at a certified lab, and this will be determined by your physician or your thrombosis team. Blood work has to be done at least 4 hours after your morning needle.
For patients receiving the medication anticoagulant, things to watch for are increased bruising or bleeding and the hardening of the skin. There are things we can do to try to minimize or diminish those risks. For example, after giving the injection under the skin, you or your child can, with a cotton ball, hold that area somewhere between 3 to 5 minutes to diminish bleeding or bruising. The other technique we can use is to alternate or rotate the areas where the medication can be given so that hardening of the skin does not occur. In the case that bruising or excessive bruising or bleeding does not stop, or it happens even when the medication is not being given, and if you notice that is happening very frequently, please contact the thrombosis service or your general pediatrician so that proper action can be taken.
It is important to tell your doctor and pharmacist if your child takes any other medicines. This includes prescription medicines, over-the-counter products, or natural health products. Aspirin and ibuprofen are generally not recommended while your child is on this medicine.
Still on the list of rare complications to be looked for, one can have nosebleeds, can have blood seen when your patient or yourself pee or poop. There can be coffee ground staining once you go to the bathroom, and even big collections of blood that we call hematomas within your body. If any of those happen, please give the thrombosis service or the physician closest to your home a call.
Enoxaparin does not require refrigeration and can be kept at room temperature. After you open the bottle, mark the date when it is opened. It is now only good for 28 days.
The more adventurous may consider activities such as body jumping and street fighting, but we also advise against them for obvious reasons: increased risk of bleeding. We have also seen the unfortunate events in which adolescents or patients entertain getting a tattoo or doing body piercing, in which the consequences were having an awful tattoo that got infected or having a lot of bleeding complications. And therefore, we would ask for you at least to wait until the medication is discontinued.